Breanna Kuhlman, and this is my speech on how to do a small wound dressing change for speech 112 at Iowa Western. I have two people here viewing my speech, my camera girl, Cherie.
Hi.
And my assistant, Rita.
I'm very sick.
And I will be demonstrating on Rita on how to do a small wound dressing. And we're going to talk about the importance of making sure you get your wound clean and the importance of having an order and how to dress a wound at a nursing facility. So, to start off, if you have somebody come in with a wound like Rita is going to have, you would need to make sure she has orders from the doctor explaining how to do the dressing change, what to use, and if she has any allergies. You will also need to make sure that it has been taken care of as soon as possible, because once the skin breaks, it is bound for infection. And that is what we try to do, is prevent infection. So, Rita here has come into our facility with a cut right along here, and she has not cleaned it like she should have. So, I've called the doctor and got an order, and our order reads that we are to clean it with normal saline, pat dry, and then apply a Mepalex, which is like a thicker Band-Aid to the skin, and it is supposed to have triple antibiotic cream on it. So I will be showing you how to do that. Alright, you will need your gauze pad, and we're going to flush the wound with normal saline, get it all cleaned out. We don't want to have any hairs or fabric, anything from your clothes in there. Always make sure you wear gloves while you do your procedures. If your gloves ever become soiled, you need to change them to prevent infection. You don't want to keep recontaminating. So now that we have cleaned the wound and there looks to be nothing in it, we are going to get our bandage ready. And anytime you have anything that is packaged, it is sterile until you take it out. So be careful on how you touch things. Alright. You don't want to apply the triple antibiotic, especially if it's in a tube directly to the skin, because then it can contaminate the entire bottle and all the nasties will get in there. So we will peel this off. You can either apply this directly, since it's on a stick and it's clean, to the wound, or you can put it on the dressing itself. In this instance, since we have it on a stick, I'm going to go ahead and just put it on the wound. So I'm going to put this on your skin right now. Alright, so now that it's there, we will be putting her Mepalex on. And you want to make sure that the sticky part on the outside does not touch the wound edges, because that will just re-tear it open.
Oh, God. Jeez.
Alright, now that it's sealed and it's protected, it's always important to date it, put the time, and initial it. This is just showing that the dressing was done, and you will have to document that you did it. If you do a dressing change and you don't document that you performed it, then by all technicality, you don't document, you don't do it. So, after all this is done, I would go to my computer, I would go into her chart and document that I changed her dressing for the specific